Hello and welcome. It's so nice to see you all, and thank you very much for joining us today to think really about anxiety and how it can impact on pregnant people and people who've are new mothers. I'm a professor at King's College London, and I'm a clinical psychologist, and I work in the South London and Maudsley NHS Trust as a CBT therapist, or cognitive behaviour therapy therapist, at the Centre for Anxiety Disorders and Trauma, where I've been developing new psychological treatments for anxiety problems. And those have been for kind of face-to-face treatments, but also more recently, digital interventions that can be offered to people through the internet or phones. I've really come to this as a clinical psychologist who's been really interested in understanding what are the thinking habits that keep anxiety and distress going, and the link between physical and mental health. And so this research has often been running experiments where we've tried to understand these thinking habits, but also then thinking about using research to also understand how we can improve treatments. So it's a real pleasure to be able to join you and to think together about anxiety in pregnancy and motherhood this evening, and really think about how research can really hopefully improve treatments for that problem. So it's a real pleasure to be joined by my colleague Nathalie Towner, who's the chair this evening, and I'll let Nathalie introduce herself.
Hi everyone, and hi to everyone who's just joined. So I'm Nathalie. I'm a research assistant at King's College London, and I work with Colette on the RELAX study. So thank you to everyone who's already sent in a lot of excellent questions we've already received. If you're going to ask a question during the event, please post it in the Q&A box. If you are struggling with that for some reason, do post it in the chat, but preferably in the Q&A box. But I know it doesn't always work for everyone. The Q&A box is the little speech bubble at the bottom or top right of your screen, depending on your settings. And obviously we'll do our best to answer your question. I'd also like to introduce Siobhean McCarthy-Perham. She is one of the RELAX study's patient and public involvement and engagement representatives, and she'll explain to you what that means. Siobhean will be helping to facilitate our discussion tonight. So Siobhean, would you just like to say a few words?
Thanks, Nathalie. Hi, everyone. So as Nathalie says, I'm Siobhean McCarthy-Perham. I am a service user. I'm a mum of 3, my youngest being 10 months old. I'm also a maternity and neonatal voices partnership lead in the Northwest. I was invited to be part of the study as a PPI representative. So that is basically involving patients and service users as part of research. So the voice of the service user is at the heart of all the research. So my personal experience is that I experienced anxiety in pregnancy, and so therefore I had the opportunity to be part of the design of this study, and could take part in kind of giving feedback during the entire process, which was a really great opportunity. So it's lovely to have everybody here today, and as Nathalie says, I will kind of be monitoring the chat and just kind of joining in as and when. Thank you.
Oh, brilliant. Thank you, Siobhean. So just a few things to tell you before we start. Unfortunately, we won't be able to answer any questions about individual cases. So please do talk to a healthcare professional if you have any concerns. Tonight's webinar is being recorded, and you'll be sent a link to the recording, which will be uploaded to the NIHR's YouTube channel. The NIHR has organised this event, and as you may know, they are a government-funded body that funds research in the NHS, public health and social care. So if you're interested in learning more about research and finding studies that you can join, please visit the Be Part of Research website. You just need to type Be Part of Research into any search engine and it will come up. And also to remember, you can take part in many studies even if you don't have a health condition. So that's all that side of things covered now. So now we can move on to the questions themselves. So I'll start with a question that was sent in, but please do add questions in the Q&A box. Our first selected question is an excellent one to start with. So somebody has asked, so Colette, how common is anxiety during pregnancy and after birth, and how does it differ from postnatal depression?
Oh, that is a good question. So I think all of us feel anxious at times, time to time. And so across the population, it's on a continuum. And when people are pregnant or have had a baby recently, then about 40% of those individuals will experience anxiety. So that's about 2 in 5 people. And in terms of kind of what we call an anxiety disorder, it's when it really is interfering in your day-to-day life for a prolonged period of time. So an anxiety disorder, about 1 in 5 people will be affected by anxiety, either in pregnancy or after birth. So a lot of people, it's really common. And when it is interfering with your life, it can be really preventing people from they might avoid situations. They're very likely to be worrying in their heads about different ways things can go wrong. It can be really difficult to concentrate, interrupt your sleep, and cause you to feel really keyed up and on edge in your body. But people also obviously can suffer from depression. And again, that's people will feel more or less depressed across the population in general. And certainly depression has overlaps with anxiety, and they both sometimes occur together. But for depression, it's more about that sense of feeling really sad. For a clinical depressive disorder, it would be that you're feeling sad most of the day, nearly every day, for a period of time, and not really enjoying or getting pleasure from things. And then there are some overlaps of what would be called symptoms, where you might also find it difficult to concentrate, those kind of things. So there are differences and commonalities between the two, and they often occur together. I think that may have answered your question.
Yes, most
definitely.
Definitely.
Do prompt me for more.
Yeah, no, thank you for setting that out. That's really helpful. So the next question, obviously we want to talk about research tonight, is, so somebody's asked, what kind of research is being done on the different ways to treat anxiety during pregnancy and after birth?
Yes, so there's there'll be different research going on actually internationally. There's a real interest in the last 10 years or so in what's called perinatal anxiety and perinatal depression. And actually NIHR, who've organised this webinar today, a few years ago, put out a specific call asking for research proposals around this issue. So they've been funding a number of projects, and certainly one of those is, for example, one on something called compassion-focused group therapy. And that's still recruiting at the moment through that Be Part of Research. You can find out more about that. I think that there are different questions. So you need to, in order to really determine whether a treatment is working, there's the clinical trial, which is often when you would have people come in and be assessed and then allocated by chance to either the treatment or another condition, which might be either being on a wait list or having life as usual, or doing a different treatment, or having something that's like a treatment but not seen to be active. So you're allocated to one of those two or more conditions, and then you'll be assessed at different time points. But really, research needs to also be looking at, well, what should we target in treatment? So what are the key things that keep anxiety during pregnancy going? And what are the key things that help people recover if you can reduce those processes? So although a lot of the research will be on testing psychological treatments or medications, there's also all this background research on understanding what we should be trying to focus on and developing ways to best do that. So that's also part of the kind of research process that's really important in kind of enabling new and more improved treatments or more accessible treatments to be offered.
Okay, thank you. And we've had a couple of questions actually that came in about the research ethics, which So someone's asked, so how do researchers make sure that these treatments are safe and effective? So how are clinical trials regulated? So how's that done?
Yeah, so any research, whether that's a clinical trial or something else, when it's either been conducted through the NHS or through a university, there will always be ethical approval that needs to be sought. And that's a kind of a rigorous assessment of does the research sort of warrant being done? So it's not just kind of, it's asking an important question in a reasonable way. Are the methods that are being used, are the questions being asked, the questionnaires, the tasks, the intervention itself, are those robust? Because obviously you don't want to sort of have people engage in research that isn't going to be meaningful, the outcome won't be meaningful. And so that there's this research process, there's this ethics process. In addition, there's other aspects, so that the NHS Trust will have a research and development office who will also, before it even goes into ethics, also go through and decide whether this sounds like it's rigorous and good quality research. All of the documentation that would be seen by participants is reviewed. We would make sure that we would also get that reviewed by people like Siobhean to see that we're expressing the ideas in a way that's accessible to people. So there's a lot of thought that goes into the process of getting approval. And then for something like if there's a medication or a medical device or software, which is one of the studies that we're conducting, is an online intervention. Those things will also go through extra regulation which is required by the government to again check the safety of those things before they could be offered during research or after research in clinical practice. So there's a number of checks and balances. And then obviously often, well, always, research will need funding, and the funding is always quite competitive. So again, the ideas and the approaches will have been sort of rigorously reviewed by other experts in the field.
Yeah, I mean, as someone who's relatively new to academic research, I mean, I'm quite, it is rigorous is definitely the word. It's, you know, taken very, very seriously. There's no doubt about that. I see that there's a question that's come in actually that ties in quite neatly with the next question I was going to ask you. We've had a question here saying, is there any research into generational anxiety, in particular whether anxiety can be passed on in families and whether it's possible to break that generational link?
So that's an interesting question. So there are so anxiety and it is that people may have a tendency towards anxiety, and that research has been done to show that there's a sort of genetic tendency towards getting anxiety, but it wouldn't decide what type of anxiety you would have. And lots of people who might have that configuration of genes may not go on to get anxiety, but you're at greater risk. So there is those kind of, there's research on that. There's also research showing that if you've experienced a lot of early trauma in your life, that puts you at a greater risk of developing anxiety or other psychological problems later. And there's also the chance that being in an environment where someone else is very anxious can communicate to you that the situation is threatening. And then the child might learn to and have a greater tendency. So there's a bit of like being around somebody who's anxious can kind of teach the anxiety, but that certainly doesn't always occur. So you'll have a number of children who wouldn't then get anxious, but you might have a higher rate of those things. So generational, I think there are these different ways. So it could be a bit of genes, it could be a shared environment that people are in, or shared experiences can lead to some level of continuity across generations having a tendency towards it. But there will also be a lot of other factors that can be both protective or increasing the risk of an individual suffering from anxiety, like or not like their parents.
Yeah. So that kind of feeds into the next question that somebody sent in earlier. They've asked, are we able to prevent anxiety? So during pregnancy and after birth?
Yeah, that's a brilliant question. And that's actually one that we've been trying to think about a lot, because that would be really brilliant, wouldn't it? That people wouldn't have to suffer all of the distress of anxiety if we could enable that. And so what we know is, again, going back to those basic experimental studies, what we do know is that there are certain risk factors for having anxiety later on. And one of those is the tendency to worry a lot. So, oh my goodness, it could go wrong in this way, this way, and this way, entertaining different negative outcomes, or kind of chewing over past events in, why did that happen to me? What is it about me why that happened? So this rumination about the past and worry about the future, a broadly termed something which is we call repetitive negative thinking. And actually having higher levels of that is going to make it more likely that you might develop and become more anxious later. So we thought, well, we could invite women who are pregnant and have higher levels of this tendency to worry or ruminate, and see whether we can prevent them having increasing levels of anxiety over pregnancy. I mean, clearly pregnancy is stressful for a lot of people. Birth, it can be stressful, and then having a new baby can be stressful. So we know that people who are pregnant, there are a number of them will be finding that situation quite stressful. And so by offering them a intervention, we're going to be trying to see whether we can prevent that anxiety going up. And that's what the RELAX study is actually focusing on and doing. And that's the RELAX study is the one that Siobhean has been really helpful, as have the other public the other people who are public involvement and engagement. Siobhean, you say the words, because I've now gone blank with my anxiety.
It's public and patient involvement.
Yes, and it's also now the term sort of moved on to sort of talking about people with lived experience or experts by experience as well. So there's the broad term, but what Siobhean and others have really made sure we do is like have the opportunity to kind of know how we could best develop the treatments and how we can best test these ideas out. So Siobhean, do you want to say a little bit more about that?
Thank you. Yeah, so I just thought I might mention here about the role of service user, and Colette said expert by experience. So what I think has been brilliant recently is this appreciation and respect for service user voice. So we use the term service user in maternity because when you are pregnant and having a baby, you're not a patient because you're not ill. So we prefer the term service user when we're describing kind of people that use the service. And this idea of expert by experience is just acknowledging the kind of depth of knowledge and the wisdom that comes with somebody having actually experienced something. And because every pregnancy and every labour, giving birth, it's all very different for each individual, not even just the process that people go through, but also in terms of how that affects somebody. So it's just putting value on how people feel and how they experience that. And as part of the RELAX study, it was just really at the forefront of the researchers' mind to really, prioritise this service user voice and, listening to people that had experience themselves of anxiety, and then using that to kind of help to frame and develop and evolve the study. And it's really refreshing for me to kind of see over the years, like how service user voice and how expert by experience has kind of increased in terms of its gravitas and in terms of the respect that it's given. While I'm on, Colette, if you've finished with that question, there is actually another question that's come up in the Q&A box. This one I think is really going to make your brain think, though, Colette, just to warn you. So the question that's coming is a really, really good one. I've just been sat here thinking about it for a few minutes. So why do you think women fear the worst case in pregnancy? So, for example, like dying, why is that the big fear that can overtake people?
Okay. So I think that our minds go to kind of unsolved problems, and if there is a potential threat and it's something big like dying, then we often have thinking habits that are fast tracking us to go worse and worse and think about the worse and worse aspect of that. And in fact, one of the things that we know happens for people who are more anxious is they tend to have their attention grabbed by threatening information, and also they tend to draw more negative conclusions when there is uncertainty. And if you draw one negative conclusion, so, oh, I don't, I'm not feeling very well, maybe I'm ill, where if that was your habit, then you would think, well, what am I ill with? I might be ill with something really serious. I will be ill with something. So your chain of thinking will go all on that negative track, and then that can take you to something that would be extremely frightening, if the idea of death, particularly if you're at the same time trying to bring life to somebody else and then be their mother and parent. So yeah, well, you guess, Siobhan.
Yeah, just want to come in on there if that's okay.
Yeah.
Sorry. I just want to come in to kind of add that I think that for me with my anxiety, one of the big things was that feeling of not being able to control something. So you're pregnant and you're carrying a baby and you feel very much responsible for that baby, and obviously there's certain ways, certain lifestyle choices that you can make that are positive choices, but in so many ways it's out of your control. And I think for me that was a big trigger for anxiety, is just not being able to feel I could protect my unborn baby in the way that I wanted to, and so then like you mentioned, Colette, about like your thoughts kind of then spiral and they get worse, and I think that was a big thing for me. So it was that lack of control, which
I think that's a really good point, that actually the sense of in another situation you might have problem solved it away, but actually there is no problem solving of unknown, because it's in the future, you don't know what could go wrong. So it's not that you have an X that you can problem solve, it's sort of like this potential threat. So yes, I think that that's a very kind of very clear and good point, Siobhan. That's very true.
Yes, so I was just going to bring in another comment we've had in a Q&A where someone's asked, I mean, this feeds into it really, about anxiety that many women will have because they've already experienced pregnancy loss. So that also they'll experience heightened anxiety. And she was asking, Maria, sorry, I hope I've said your name right, asking if there's any research on how having experienced pregnancy loss can affect a woman in her next pregnancy.
I think it's a very good question, and I've experienced pregnancy loss, and I know that made me much more anxious. So I completely agree with that point. And my understanding is that certainly that would be common, particularly if people have had multiple pregnancy losses, or pregnancy losses that are a bit aren't right at the beginning of the pregnancy. Whilst I don't know the research to hand, there is certainly evidence to support that idea. And I think that can make it, really hard, and reaching out and having support from midwives and health visitors can be important, and talking about and being able to voice that you're actually very, that you've had that experience and you're feeling anxious. I think that said, you can also, even if you haven't had that experience, be concerned about it. You may have heard of friends that's happened to, and actually I think that it's really important to try and talk to your midwives and GPs and others, just to voice that you actually are feeling anxious, because it's very normal. It can actually be really kind of interfere in your life. Siobhan.
I just wanted to say about that some trusts offer something that locally they call the rainbow pathway, but it may have different names depending on where you are geographically. But that is a pathway that is slightly different to kind of a pregnancy if somebody's never experienced a loss before. So it's specifically for women who are pregnant having previously had a loss. And it's so incredibly important because it then just means that they get the extra support that that you are likely to feel in terms of anxiety and your mental health, that maybe if you've never lost a baby before, there may be thoughts that would never even cross your mind. And actually when you've experienced loss, and I'm speaking from my own personal experience here, like just it's a totally different experience being pregnant again after you've experienced any kind of loss. So those kind of pathways can be really, really supportive for anyone who is pregnant and has experienced any loss. And if you haven't, had this mentioned by your trust, if anyone is pregnant on the call, it might be worth asking questions about that from your community midwives, because they can definitely signpost you to some help and support.
Yeah. And I had help like that as well, and that was important, although I still did remain anxious, but at least there was the support there. So it's not, it doesn't necessarily, we can't take away those fears, but certainly having support with it is really important. Yeah,
and it's great to see it being recognised. Obviously there was the announcement today that women who've experienced pregnancy loss can have bereavement leave. That was announced today, so it's sort of great to see things moving, sort of recognising that more. So, I mean, just to flag up that in the chat, Liz has posted a link to the RELAX study if you are interested in finding out a bit more about the study that we're all working on. And working on it, you are really aware of how much the participants value being part of it. And obviously, we don't know yet, it's still an ongoing study. But this feeds into the next question, which is really more questions about the practicalities of taking part in research. And someone's just asked, I'm interested in taking part in research about anxiety during pregnancy. How can I find out about studies that are looking for volunteers? I don't know if you've got anything, of any, Colette.
So I think certainly look at the Be Part of Research NIHR site. And I think the other way of finding out about research is actually your local trust will no doubt have a research and development office, and they will know about the studies that are being run through that. And also health professionals are also often aware of what research is going on in your local area or nationally. Yes, our RELAX study it's closed for participants to join, but it is a study that we're trying to look at prevention using a different type of approach, a kind of a brain training to help change the unhelpful thinking habits. For the first time, we're beginning to look at that. We know that can be helpful to reduce anxiety and depression in people who are not pregnant, people who have depression and anxiety, but we're now looking to see whether this kind of brain training can be helpful to prevent anxiety. But yeah, I don't know of other specific studies at the moment, I'm afraid. Siobhan.
I was just going to mention that some trusts actually have research midwives who are really focused on research, obviously to do with maternity. So if anyone's interested in trying to get involved in research locally, that they might be a good person to kind of speak to. And also a lot of trusts in the kind of waiting room areas that you get in like the maternity outpatient departments. If you actually look on the walls, quite often there's kind of research that's happening in that local trust, in that local maternity department, posters and things up. So and also in GP surgeries. So sometimes it's just a case of literally just looking around where you are and maybe reading posters that maybe you've looked at before but never really properly read in terms of local opportunities.
Great.
So Colette, you talked a little bit about what it meant to be a participant on the RELAX study. I mean, can you give us a sense of what people have to do when they're part of a research trial, the different types of things that might be asked of them?
So for psychological research, you might have an interview that would be trying to kind of find out how how you're experiencing, for example, anxiety now, so that may be part of it. Quite often people would complete questionnaires which are used to kind of measure something like anxiety. It's obviously, anxiety is an internal experience, so it's sort of how do we measure that? There are ways of measuring biological what are called markers for anxiety, but actually in large scale studies that's not particularly feasible. And actually in clinical work we would be giving people questionnaires to understand how anxious they are, and then whether that's changing over treatment. So we do the same approach with research trials. And then depending on the intervention that's being tested, people will be allocated to that. So for our study, it involves listening to short descriptions of situations that our lived experience members helped us develop that were pertinent to the day-to-day lives of pregnant women. So some of them nothing to do with pregnancy, but to do with general life, and some of them specifically about pregnancy. And these were just sort of situations where there was some uncertainty, and the uncertainty was then resolved in a positive way, or people were asked to resolve it themselves in a positive way. And in this way, we can kind of train a more helpful thinking habit. So rather than drawing the negative conclusions, we can help the brain change that habit to draw more positive conclusions, which is what people without anxiety, worry, or depression and rumination experience. And so people can go onto the platform and then complete these sessions over a 4-week period, and this changes that thinking habit. And as I said, in other studies we've shown that reduces anxiety and depression in the longer term, and we're seeing whether we can prevent anxiety going up in the particular study that we're doing now. At the end of that, people then do another set of assessments, so the same questionnaires and tasks as before, and then we also would then ask people to do further assessments later. So for the relaxed study, we wanted to know, well, does our relaxed training help, and does it help a month later, before people will have had their baby, and then a further a few months after that when they will have had their baby. So we're trying to assess whether the anxiety is reduced compared to people who are having usual care without having the training that we're doing. And in that way we can work out whether we can make an immediate change in anxiety, and whether that's sustained for a bit, and whether that is then actually able to make an impact later after birth and being a new mum, which is obviously a challenge in itself. So
yeah. And it's definitely a time commitment for the participants. You know, they do give up quite a lot of their time to take part in a study over quite a long period. So that's really the question, is like, why do people take part in research? Is it altruism? Is it to further, to further knowledge, or is there any actual benefit to the individual to taking part in research?
I think that it is relatively altruistic. I think that a lot of research studies like ours do provide a voucher to cover the time that people are taking on those assessments, but I still think it is at a commitment. I think that people might find it interesting to do, but I really think it's because they're wanting to enable us to advance our understanding and then improve treatments. And what's really important is that when we are recruiting participants for studies, that they're really representative of the whole of our, the whole of society. Because what we want to do is make sure that if the treatment is shown to work, it's working for everybody. And if we only recruit a small amount of of a particular type of person, we don't know whether they would also be useful and helpful for people who have other cultural backgrounds, or have other challenges of having deprivation in some way. It may be really difficult for those individuals to engage with these kind of treatments if they're really if they find it harder to access the technology that's relevant, or feel that it doesn't really work for them as an intervention. They don't find it appealing. So I think that it's really important that people consider engaging in research. And I think it is that you're thinking, well, this could help someone like me in the future. If it is helpful, whether or not I'm in the treatment condition, it will help people in the future who like me and my friends. That's probably why a lot of people do it.
Yeah,
Siobhan.
Yes, sure.
I just wanted to say as well that the people that took part in the Relax trial and they basically got to test out a treatment, but then they benefited from testing out that treatment. So obviously, when you're doing any kind of trial like this, it might not work, but by them giving up their time, they then actually hopefully benefited from doing the experience. And I was part of the trial, kind of the pre-trial almost, so I wasn't a participant, but I was able to kind of test the scenarios out prior to them obviously being used with actual participants. And what was really interesting is, even though at the time I wasn't pregnant and I wasn't obviously suffering anxiety in pregnancy, is it really kind of changed the way I was thinking, and it made me kind of look at things from a different perspective. So I benefited by doing the pre-trial trial, just in terms of that kind of way that your brain works and that. So one of the big benefits in that particular trial was the benefit of hopefully reducing anxiety to them, aside from the fact that they hopefully will it will benefit other people as well.
Yes. Thank you.
I think that's an excellent point, Siobhan. That's that is a good reason to do research, as well as obviously for the altruistic reasons, but it's also you can benefit, if you suffer from something, you might be one of have a sort of chance to be one of the first people to try something out. So the next question that was sent in was actually, so just to flag up, actually, if people do want to ask questions, you can post in the Q&A bubble, and if that's not working for you, we are also monitoring the chat, so please do go ahead and post any questions that come to mind. Siobhan and Colette probably could both answer this one. Are there ways of getting involved in health research that don't involve actually signing up to a trial? Are there other ways you can participate in research? And obviously Siobhan would be a good example.
Do you want to go first with that, if you've got some ideas, and then I'm happy to chip in?
Yeah, absolutely. So quite often my role is not actually being part in the research as such. It's kind of being part of the research team. So as Colette mentioned earlier, on the Relax study, I was deemed an expert by experience. And so my role was just bringing the service user voice into everything that we were discussing. And for me, I kind of have a science background anyway, and I just find that research is really, it helps to keep my brain working. I'm a mum of 3, and it just kind of makes me think in a different way. And the kind of intellectual challenge, I think, is what I'm trying to describe. I find from being involved in research is really interesting, and I love hearing about kind of the results of trials that have taken place, and to know that I've had some kind of part in that, some kind of influence. I personally really enjoy. So you don't necessarily have to be a participant if you've got, if we're talking, for example, in maternity studies, if you have had children, then you've got your own experience, and therefore you've got something of real value to kind of bring to studies. So sometimes it's just finding something that you're interested in, and then bringing that service user voice to it, rather than necessarily being a participant testing out a particular treatment.
Thank you. And I mean, I think that the kind of ways you can hear about other studies would also be through universities will have studies that they will be running, so you can approach the research and development office of universities. And I think there's quite a lot of the time there's projects going on through third sector organisations. So again, contacting them and finding out about, are there studies going on that they're looking for volunteers to be part of. So I think obviously there's the be part of research, but there's also wider than that. And I think be part of research from the NHR won't just be clinical trials, it will be other studies as well. So there are different ways to kind of get involved. And I think, as said before by Siobhan, the research midwives are also going to be hearing about studies that maybe just a one-off, half-hour study, which people will be recruited to. They don't have to be these longer studies, which are a commitment of time.
Thank you. We just had another question come in. So do you have any thoughts on using apps to manage well-being and anxiety, or any other useful tools? It's quite interesting, is it now, to think, is this an alternative to taking medication, for example, or is it something that should be used alongside medication? Or it's clearly a sort of digital therapy seems to be quite a big growth area. So what are your thoughts on that, Colette?
Yeah, so certainly apps can provide people with support, and I think it really depends on what the app is offering. And I think it can, I mean, obviously social media can be seen as a thing that drives a lot of anxiety for people. So I think that, apps can be used in useful ways. I think you wanted to find out and know whether the app has evidence behind it, and so that it, again, if you were to find a app which is regulated by the MHRA is the term here, then that you would know that has some sort of support for the idea that that's helpful. So I think that other things can be, I think well-being apps can feel supportive, and that's fine. I think if that helps you, but I think it's just important that if you do have a real full-blown clinical problem, that actually perhaps making sure that you're having something that is likely to actually be effective is important. I mean, the Relax study, we are now moving to develop an app version. So at the moment it's on a computer. People have to be on a laptop or tablet. But now we are planning on developing an app version of that. We didn't do that originally because when we were thinking about the research ideas years ago, the way people engaged with their phone was much more casual, and they didn't really concentrate or look at their phone for prolonged periods of time. And so we felt that in order to deliver an intervention, it would be better to have people kind of be able to take time out and actually look at a screen at home rather than doing something on the bus. But actually, I think things have changed, and the way people engage with phones has changed. So we will be testing that out in the future. So yeah, I think there's a range of different things that could be helpful. And I think it depends on the degree of distress you're experiencing at the moment. And certainly if it's very high and it's really impacting on your life, I think go to your GP and try and get some established treatments. That would be my suggestion. Siobhan.
Just to come in on there, and I don't, some of the things that you've said is what I was going to say anyway, Colette, so I don't kind of want to no, don't apologise at all. But just to say that, depending on the severity of the anxiety, if it's kind of mild anxiety, there's a lot of apps, to do with mindfulness, meditations, even listening to kind of calm music and things that can actually be really, really beneficial. But it's always worth kind of getting some professional help, like Colette said, and speaking to a GP maybe. And it might be that they can be managed alongside some medication if that's what is deemed is necessary. For example, to like help you sleep and help you relax. So there is a lot of really good apps out there that have a lot of potential, but yeah, just the caveat of very much does depend on the severity, as Colette said. Thank you.
Thank you. And we've had a couple more questions come in. So somebody's asked, how can we support women who've been affected by anxiety throughout the pregnancy and are struggling as a result to bond with their baby or their child as a result? Do you have anything to say to that, Colette?
Yes, and I think there is actually there was some people who were interested in that question who are researchers in Oxford. There has been some evidence to suggest that if people are extremely anxious, if new mothers are extremely anxious, that can make it harder to bond with the baby. And then similarly, if people are really depressed, which is one of the reasons why it's kind of important to get some help. So there will be research. I suspect there might be some research going on in Oxford on this question. but I don't know exactly at the moment. But yes, I think it is something which is one of the ways that the wider impact on the family of a person feeling anxious at that time when you're bonding with a new baby. That obviously will make some individuals on the call feel really anxious because they will already be worried about things. And I think what we have to do is, well, Siobhan and I both have expressed that we were both very anxious during our pregnancies. And so, things do move on and you do recover. So it's, it is, whilst it overall, it's kind of, it can cause some challenges with bonding. It also doesn't mean that won't be resolved. And again, having some help and asking for help is kind of the suggested way forward. And it's certainly not your fault if you're feeling anxious. It's nobody's fault. It's just anxiety is a really powerful thing. And what I would like for people to be able to choose what they do in life, not because of anxiety, and not have anxiety choose it for you.
Yeah, and the same contributors also sort of said, what about the anxiety is then exacerbated by having a sort of trauma during the birth that is then leaves the mother feeling disempowered and unimportant. And I think, unfortunately, that is an experience that we do hear women can experience that.
Yes, and I think that anxiety about birth itself is and a number of women will be specifically really anxious about the birth, and clearly a bit like Siobhan was saying that having had a pregnancy loss, you then are more anxious. But certainly, if you may not have had a pregnancy loss, but you might have had a traumatic birth, then that can make the prospect of the next birth really challenging. And again, reach out to your midwives and get that extra support. And psychological help can be given. So just to say that when women and their partners, when women are pregnant and in the first year after birth, they and their partners get prioritised for psychological therapy wait lists. So you need to let people know, or your partner know, that if they are feeling anxious and depressed, that they should flag that really strongly and say, I'm pregnant, or my partner's pregnant, and or we just had a baby, and you should be then fast tracked to quicker treatment. And that's because we want to make sure that the challenging time, which is amazing in lots of ways, but kind of really daunting for everybody. If you're already feeling anxious, that's an even harder situation. So we I think that's why the NHS wants to prioritise access to psychological therapies in that context.
Yeah, and there are sort of dedicated within the talking therapy service, they do sort of have dedicated services, sort of the perinatal and postnatal period. We've had an interesting question here. Are there support resources available for men as well as for alleviating anxiety for themselves and supporting their partners? And that's another side that perhaps is we don't consider as much. Like, what about the partner?
Well, certainly, as I just said, there is an importance for the men and partners, and for psychological therapy services. There is that priority just as much for men, for men whose partners are pregnant and who have recently given birth. And there is research being conducted on perinatal anxiety and in men, and so certainly you can look at. I think some research might be going on at Nottingham in relation to that. So you might be able to find out some more there. Siobhan.
There's also, just thinking about support for dads, there is also lots of kind of groups now that are designed by dads for dads, just to try to encourage dads to kind of talk to each other and support each other, because there's a lot to be said about kind of peer support, during during the time when you're having a baby. And I think that's something that is becoming a lot more common now, is where people are, men in particular, are feeling a lot more confident being able to talk about their mental health and things that previously maybe have been a little bit taboo. And those dads charities as well, they quite often produce kind of support that is aimed at dads, so it's been written for dads in mind, because I know from talking to some dads that I work with as part of my MMVP role, that they really feel sometimes that lack of control. So they obviously have this person that they love who's having a baby, and that they don't feel they can protect them sometimes can be a real cause of anxiety for men and for the dads. So there is a lot out there. You just have to kind of like sometimes find it. So things like Dads Matters and Dads Net are both groups that help offer support to dads.
Great, thank you.
Thanks, Siobhan. That's really helpful. And we've got a comment here. I think perhaps not really a question, from the Sheffield, or a representative from the Sheffield Diabetes UK group, saying diabetes and pregnancy are seen as high risk even when the expectant mother has perfect blood glucose results. And I suppose that feeds into the sense of anxiety being exacerbated when you're suddenly told you're on a high risk pathway, when but you're suddenly on a very medicalized pathway in hospital, when you might feel that otherwise you sort of lose control of how your pregnancy is going. I don't know if you have anything to add there, Siobhan or Colette.
I certainly think that there is a lot of challenges when people have long-term health conditions like diabetes. In any context, the interaction between that and kind of senses of anxiety is really important. And I think that actually some research needs, more research is being done to try and make sure that individuals who have long-term conditions like diabetes or other long-term conditions actually have better treatments pathways for them, because actually sometimes the treatments don't work so well when their anxiety and distress is really driven by the physical health condition that they're suffering from. And so certainly at King's, where I work, there's a number of projects being conducted within the health psychology department, thinking about that interface between physical and mental health. So I certainly agree with the comment that it is important and more challenging. And again, I would I think that as if it was just reach out and try and get support. And also there is research going on, and things are going to be improving. But yes, I think it is a more challenging situation to be in, going into, you're healthy, but then you're being told that being pregnant, your diabetes might get more challenging to manage, and those kind of things must be another burden and worry.
Yeah. And I've got a question here that was sent in by a healthcare professional, just asking how can we identify women who are struggling with anxiety in pregnancy and after birth, and what can healthcare professionals offer if people are anxious?
Yeah, so I think that the main thing is to listen to women and hear if they're mentioning and saying that that they're feeling stressed or worried, and maybe just openly asking people, because actually I think to open the door to a conversation is really important. So I think if you then, from what you're hearing, think that it sounds like that person is having their worry or anxiety kind of impact on their day-to-day life, then I would really then again encourage them so that the midwife could then try and suggest that the person considers different options for getting more support, including letting them know about talking therapy services, where in the UK, across the UK, we have talking therapy services you can get referred to by GPs and others, but also if you happen to live in England, then you can make a self-referral to talking therapy. So that's another option for you. Siobhan.
big thing that I would say from a service user point of view is when you're having those conversations about somebody's mental health and how they're feeling, is making sure that they know that you care, because too often, because health professionals are told they have to ask the question to women who are pregnant. I'm thinking kind of community midwives, they've got loads of questions they've got to ask the pregnant person, and they know they've got to ask a question about their mental health. It can sometimes feel like it's just a tick box exercise. If I'm going to ask you this question, you're going to say yes, I feel fine, and then we're going to move on. Whereas actually, if you, like Colette said, you really open up the door, you start the conversation, you let them know that you're listening, and this can all be in body language and tone that you're talking. All of these things are so important for communication, that actually then they really feel that then they can open up and trust you. Whereas actually, if they feel that you're just asking the question just to tick a box, they're much more likely to go, yes, I'm fine. So give them the space to talk, make them feel important, make them feel respected, and that you're going to listen to their answer, and that you care about how they're feeling is so important. Thank you.
And I think, yeah, no, that's really helpful. And actually, also just thinking about the language and the words that people use, because obviously people with different ethnic identities might not use the word anxiety, and so they might use the word stressed or worried, or it might be that they have more physical sensations which are part of the what we would be saying was anxiety. But so I think that actually just picking up on those things as well is important. Siobhan.
Just to very quickly add to that, Colette, that point about not using the term anxiety, a lot of kind of service users, unless they've been diagnosed with anxiety, they wouldn't necessarily say I'm feeling anxious. It's not necessarily the vocab that people would use. And so you're absolutely right. You need to listen to more than just the individual words, because to say I am anxious or I have anxiety sounds quite serious, and actually if they've not been diagnosed, they might not appreciate that they are necessarily anxious. They may use different words to describe the same thing. So really good point there, Colette.
Thank you. And we just had, and this will be the final comment because I can't believe it, it's like 1 minute to 8, so the hour's really flown by. But Cassia's sort of commented, an anxious person may also worry that they're being judged when asked about their mental health in pregnancy. So I think
that's very, very true, and that's where Siobhan's point about communication in the way that your body language is being kind of open and non, because I think people do fear that they will be. Some people might fear that they will be judged. So it's a very good point.
Yeah. So that is it in terms of questions. So thank you, Colette. We're going to let you sort of catch your breath. And obviously, thank you, Siobhan, and thank you, obviously, to everyone for providing your questions. I hope you found it an insightful and informative session. And obviously, thank you to our host, the NIHR, for organising the event. If you do want to learn more about research and how you can take part in studies, search for the Be Part of Research website on any search engine. And obviously, please remember, you can take part in many studies, even if you're not living with a health condition. You will receive a recording of tonight's event and an evaluation form. Please, we'll be very grateful if you take a moment to complete it. And we want to run more of these events and know what we're getting right and what could be improved. Colette, do you have any final words for our guests?
No, I mean, thank you for coming. And I think that if you or one of your loved one is feeling anxious, do let them know that there are ways to overcome that lots of people experience anxiety, but they don't need to carry on suffering and hoping it'll just disappear. They can get support and help, and those brave first steps to reach out can be really, really important.
Thank you, Colette. And now it just remains for me to thank you all, and we hope you have a pleasant rest of your evening. Thank you for joining us tonight.
Thank you, everybody. Bye.
Bye.